On today's World Insight, eyes fixed on a vaccine at a global summit. Billions of dollars for research raised at a virtual gathering. What this means from the CEO of Gavi, the Vaccine Alliance. Key pandemic lessons learned from SARS to COVID-19. Yuen Kwok-yung, a microbiologist who battled SARS, talks about the origin and the war against the coronavirus.
We have a new normal. We must conserve all the wild animals and their ecology and their habitats.
And the state of U.S. politics tied to the China-U.S. trade deal. Professor Graham Allison sheds light on how the world's two largest economies can ease tensions. Here is our host, Tian Wei.
Hello and welcome to World Insight on CGTN. I'm Tian Wei in Beijing. We start with the good news. The Global Vaccine Summit, hosted virtually by the UK on Thursday, raised $8.8 billion for routine vaccinations in some of the world's poorest countries. British Prime Minister Boris Johnson announced the figure at the end of the 3.5-hour online session. Chinese Premier Li Keqiang, along with officials from more than 50 countries and regions, attended the virtual meeting amidst the current COVID-19 pandemic. The Global Vaccine Summit raised funds for a Global Alliance for Vaccines and Immunization, also known as Gavi. It is a UN-backed alliance supported by joint efforts from government and private sector that help get vaccines to developing countries. Chinese Premier Li Keqiang announced China's donation of $20 million to the program.
China has enjoyed good cooperation with Gavi. The alliance helped found a program in China involving expanded vaccination and international application of vaccines. To meet the challenges of COVID-19, I am pleased to announce that the Chinese government will make a contribution of $20 million to the Gavi funding for the period 2021 to 2025. We will also encourage Chinese research institutes and vaccine producers to collaborate closely with Gavi and support its important role in promoting vaccination coverage.
About Gavi, a few weeks ago, I sat down with the CEO of Gavi, Dr. Seth Berkley. He praised China's swiftness on containing COVID-19 and sharing the genetic sequences only 2 weeks after observing outbreaks. He gave his opinions on how governments around the world could work together to accelerate the R&D for COVID-19 vaccine. Let's listen in. Compared to Ebola, the outbreak of Ebola about 10 years ago, now you see the world has been a little bit different, to say the least. Geopolitics and politics, nationalism, things like that. I don't want to throw the big words here, but the reality is that once the vaccines are being made, tested, and can be put into the market, whether the world will be able to share it or it's likely to be nationalized by whichever country.
Well, of course, I think nothing talks about the importance of having a global view as this particular outbreak does. We need to understand that any infectious disease, any time, can do that. But second of all, we also need to understand that the best ideas, the best technologies may come from any of the different countries, and it may come from multiple countries. We may have a vaccine from one country, an adjuvant, which is a stimulant to make the vaccine work better, from another country, and a manufacturing from a third. So from my perspective, we need to think of this as a global solution. The other issue is that we don't know in 18 months where the epidemic will be, and therefore the vaccine needs to be made available wherever the epidemic is, because if we have large groups of people in the world with an uncontrolled epidemic, it threatens the whole world because it can reintroduce, as we saw it happen in this case. So, you know, from my perspective, science is global, and so does this response need to be. Of course, every country wants to make sure it has access of the appropriate tools for its citizens, but it can't only be for its citizens if it wants to make sure these epidemics stops. It has to be a global perspective.
One has to bear in mind that even for organizations like yours, there are major fundings coming from certain countries or from A country or country B. Will that have an impact on your decision and the way of doing things? Will that put a limitation on the kind of cooperation you could have with either countries or organizations or individuals?
So I think the wonderful thing about the multilateral system is that we receive funding from all of the G7 countries, but we also receive funding from all of the BRICS countries. And, we're working with a wide range of supporters. And so there is a governance mechanism that obviously each donor has a voice in, and each companies, because we also work with vaccine companies across the world, both in developed and developing countries, and obviously working with many recipient countries, they all have a voice in the governance mechanism, but nobody has a controlling voice. And so the idea here is that we work for the good of the world. Of course, from time to time, we will be going out and asking for more money, and we're in a replenishment period now. We fund ourselves every 5 years, so that it's not about every time something happens, you go out and ask for it. It's rather, how do we build a system that can operate for the good of the world continuously over a time period and adapting?
If politics is not a problem here in this issue, what about money? I mean, now we've seen pharmaceutical companies that have been running against the time to develop the vaccine. We also see labs active around the world trying to do their work in this regard. But once the vaccine is being developed and also produced, will there be killer price for them? And will people be able to afford them?
So first of all, I didn't want to imply, if I did, that politics is not at play. In an epidemic like this, of course, there is going to be politics at play. What I'm saying is that the importance is to isolate the truly global mechanisms and make them be driven by science and not politics as much as possible. In terms of finance, I do think the world will need to step up, because I think one critical question is going to be, how do we manufacture large amounts of this vaccine, because there'll be enormous demand for this, both from places that have acute disease, but also from the worried well. And so we need to make sure we'll have adequate quantity of the vaccine to be able to use it to control the epidemic. My own perspective is that vaccines are a global public good. Most countries provide the basic vaccination for their children, and it's not done by being paid or in a commercial market. Of course, companies are involved and they make profit in it, but the purchaser is the governments. That's true in China, it's true in the United States, it's true in Europe and most of the world.
Last question before we go. As someone who has been working on vaccines, looking at epidemics developed at different stages at different times, what do you worry the most? And what would you suggest is the solution for those who are watching our interview today, Dr. Berkeley?
Well, of course, at the end of the day, I worry that we have the best science making the products. But what I worry about, of course, is that a product that is not available to where it's needed does us no good. And that's the fundamental reason Gavi was set up, because new vaccines, the science is moving so quickly and so well, but these new vaccines weren't available to people who needed them the most, those living in the poorest countries. And that was because of cost barriers and systems barriers. And so we worked to try to solve that, and as I've said, have been quite successful. But we know it is evolutionarily certain that we will continue to have outbreaks of infectious diseases. President Xi has said this as a priority for China. We need to be better prepared, but that's true for every country. So how do we put that system in place so that when a disease occurs, we have a vaccine as soon as possible and it's made available to those who need it? That's what drives me. And it's the opposite of that would worry me, that we didn't make sure that we made these things available to everybody who needed them.
says Berkeley, CEO of Gavi. You're watching World Insight. Coming up on our program, as some countries overcome COVID-19, others are beset by unrest. Yuen Kwok-yung, a microbiologist who battles SARS, discussed how to fight the latest coronavirus.
In this episode of Travelogue, we reach the end of our epic journey along the Pearl River. We discover the many ways in which the millions of people living among the mountains of Yunnan province at the river's source are preserving their traditions.
You're watching breaking news on CGTN.
Welcome to the world today on CGTN.
Welcome back. You're still watching World Insight. I'm Tian Wei. After 5 months of hard work, the spread of COVID-19 in China is under control. Now, the discussion regarding the pandemic in this country has shifted to whether it should reopen to international travelers. With concerns about imported cases, are we going to accept living alongside the virus as a new normal? How should China's border control safeguard its people? With all of these questions in mind, I sat down with Professor Yuen Kwok-yung, who is a chair of infectious diseases from the Department of Microbiology at the University of Hong Kong. He discussed how to prevent imported cases while at the same time streamline the system of the so-called new normal. The latest situation, testing in Wuhan. Everyone almost in Wuhan has gone through it. Now, the new cases almost close to zero. So how should we understand the result?
I think it's a good sign that there is no evidence of virus circulating in Wuhan. But that is also not that a good news because as far as I know, the zero prevalence, the percentage of antibody positive in the Wuhan population is low, which means that the herd immunity in Wuhan is also low, which also means if there is a reintroduction of the virus, there would be a major outbreak in Wuhan either.
When we talk about herd immunity, there has to be the precondition of massive infections and also things like that. So where are we if we talk about good and bad?
It is both good and bad. Because low herd immunity, it means that your control measures has been very, very good.
Yes.
That is a good news. But the bad news is that if you cannot control the border and there are viruses going in with incoming travelers, then you can get into trouble. Once the general awareness that all the mask wearing and also the hand hygiene is getting not that good because people become fatigued after all these hygienic measures for so many months. So at the end of the day, it is both a good thing and a bad thing. And my advice is that in Wuhan or any parts of China, including Hong Kong, in Hong Kong, we ask the government to do extensive testing. Anyone who have even very mild symptoms must be tested by RT-PCR. We must continue to wear masks. We must continue to do extensive testing to get early case detection, especially in mildly symptomatic individuals.
That's another question I want to ask you, Professor Yuan. You see some of the economies in the world already open up. Some would possibly be categorized as premature if you look at the guidelines of WHO. However, they did open up, and therefore we are seeing more circulation of populations among those countries. And now, here comes the dilemma. If China opens up the border, of course, more confirmed cases will come in. There's bigger chance of infection and danger. However, if it doesn't open up the border, let's just say a few weeks from now, it's going to be a big hit in terms of China's interaction with the rest of the world.
I don't think it is an issue at all, as long as we have the correct countermeasures in place. For example, if people came to China, wants to come to China, they are required to have RT-PCR testing within 5 days before they travel. And then once they arrive in China or in Hong Kong, they must be retested at the same time to make sure that they are not shedding the virus. And once they come in, they are always required to wear a mask, do hand hygiene. And they must report to the authority, to the health authority, if they develop any symptoms. Without travelers, without the business going on, the economy will be so bad that it can be worse than the pandemic.
Listen to your advice. Already a long list of things they have to do before coming here, and a long list of things they need to do after coming here. They need to open up their mobile phones to the Chinese app, which some think might be sensitive too. So all of these requirements have to be met before they want to make a trip to China. Of course, this is going to be complicated and challenging for every one of them. And do you think that will be?
I don't think it's complicated at all.
Yeah.
It's not complicated. You get a test before you travel. And nowadays, how many tests are being conducted in New York, for example? So you get a test before you come. You come in, the test can be done at the airport. So it's not complicated. Health declaration is also not complicated. It can be done on the web. And for WhatsApp, there is some sensitivity because you are being tracked of where to go. But it is a new normal we have to accept because the pandemic situation is still there.
This is what I really want to ask you. The next question, Professor Yuen. I see you are very passionate about this issue, the new normal, so-called.
I think the first is we must acknowledge the need for a new normal. If you don't acknowledge the need, there is no point in talking about it. The second thing is that we now know very well that all these pandemic or emerging infections will come again and again. If do not have good measures to prevent all these emerging infections to spread, we are in deep trouble. I think from now on, every traveler must make health declarations, not just temperature checking. It is a must. Second, if you have the vaccine, you must have the vaccine first. Document that you really have neutralizing antibody in the blood before you can travel. But maybe you are suffering from another emerging infection that we do not know about. So all this healthcare declaration has to be in place. Now, finally, I think everybody have to recognize some very important thing, that we can no longer allow any live animals to be in our markets. Now, this is for China. A lot of Southeast Asian countries, African countries, South American countries do have live animals in their markets. Even Hong Kong, we have live poultry in our markets. And we have to stop such practices from now on. Finally, we have another very important new normal that we have to accept. Is that I think everybody in the world must have their own individualized or personalized epidemic combat kit with reusable material. Now remember, when you are using all these disposable masks, this is very environmental unfriendly, and it is very wasteful of material.
Yes.
We should have a mask that fit our face very well. It can be washed and be reused, and even gowns covering outside. And also, everybody should have a pocket alcoholic hand rub. So I am carrying alcohol hand rub myself. I can show you that I have alcohol myself in my pocket, so that when I touch anything, I would use this hand rub to make sure that my hands are well sanitized. I think that is another new normal that everybody have to accept.
Professor Yuen, I can see you're practicing exactly what you're preaching. So that's a great
Yes,
thing.
I believe I think what I think, and then I talk about what I think, and then I practice what I think.
Though China has made great achievement on containing COVID-19, internationally the virus is still spreading rapidly, and not many countries are taking control measures so rigidly as China did. In some countries, even social distancing is still not happening. On the other hand, economic difficulties together with political struggles are making epidemic prevention nearly impossible. So how do health experts see all of these challenges at the moment? Professor Yuan gives his take. I'm afraid there is a huge divide of what you, as a microbiologist, and most of the people in the world think about as the new normal.
I can see that some people would never listen to advices. Even in Hong Kong, for example, only 97% of the people wear a mask. 3% doesn't. It doesn't matter. As long as you have a majority of people wearing masks, for example, it is already sufficient to stop an infection. If one people can transmit to another people all the time, they call it the basic reproductive number 1, then the epidemic will continue. But if there is more than 50 to 60% of people already wearing masks and stop the infection from spreading, if they do it correctly, they do hand hygiene.
Professor Yuan, you may know very well, this whole new normal, as we say, it's not just about hygienes and precautions. It's also about systematic approach. Now, what second thought shall we have about the public health system, whether it's China or in other countries?
I think it's just very clear that there are two main issues in terms of this public health crisis. The first is the lack of a global system for real-time sharing of information. That means that the things are always delayed because every country wants to investigate carefully before it informs other people, before things are being confirmed. They are afraid of wrong information and then lead to embarrassment, etc. But I think this mentality has to go. Even before we are very certain, we have to share the information so that other people know what's going on. Now, the second priority is the search capacity. And I'm sure you have heard that in France, they have thrown away a lot of outdated masks, and then they found that they have no masks to use, for example, because piling up of search capacity, piling up of masks, PPE, personal protective equipments, drugs and vaccines is very expensive. They have a limited shelf life.
Yes.
The government have to prioritize and put money into the search capacity, and also to make systems of real-time sharing of information. Now, so these are the things that I saw. That is very important.
As a microbiologist, Professor Yuan has been among a high-level expert working group which confirmed that COVID-19 was capable of people-to-people transmission. But long before COVID-19, he also fought against the SARS 17 years ago, another coronavirus which broke out in 2003, severely affecting cities like Hong Kong, Guangzhou, and Beijing. He was the one who traced the SARS back to its animal host. He advocates keeping wildlife away from humans, particularly in the market. Also, he criticized actions of politicizing the origin of the virus and calls for concrete measures to contain the outbreak together. Professor Yuan, you have been widely respected because of your contribution. 17 years ago, during the outbreak of SARS, you were speaking out, you were doing research about it, you were putting precautionary message to everyone. What was it like at that time for you to dig into what exactly, scientifically speaking, is happening, and came up with the kinds of cautioning and suggestions then?
I think one of the most important lessons that I learned after SARS in 2003 is that the virus is coming from wild animals. Initially, we thought that it's the civet that is causing the problem. Later, we found that the bats, the Chinese fossil bat, is most likely the animal, the natural reservoir of the ancestral SARS coronavirus. And since then, we have been doing a lot of virological surveillance in wild animals. And in fact, 2 years later, in 2005, we find that around 39% of the Chinese fossil bat are harboring SARS-related coronaviruses. By the year 2007, we actually sound the alarm. We wrote in a reviewed journal called the Clinical Microbiology Review that we really have to be careful because we think that this SARS-related coronavirus in the Chinese fossil bat is a time bomb. We have to be prepared. If we don't prepare, then we can get into big trouble. So, lesson for every one of us is that don't think that SARS is going away. It's not. 2003 SARS is the first attack. Now we have this COVID-19, which is a SARS version 2. And I'm sure there are SARS version 3 and SARS version 4 coming. I'm sure that it can happen because wild bats contain they have a lot of SARS-related coronaviruses. And they will continue to recombine the genome, exchanging gene fragments, and then form new viruses. We must respect the life of wild animals. They are part of our ecology on the earth. They have a very important role in eating up mosquitoes and other insects to prevent the ecology from collapsing. They are very useful and important animals. We should respect all these wild animals. We should not catch them, farm them, or eat them. Remember, through thousands of years, we have been living with the domestic animal like cats and dogs, cattle, sheep, etc. We are quite adapted to their viruses. So even if some of the viruses jumping into us, usually there's no big problems. But we are not living along with these wild animals in the past millions of years, unlike the domestic animals. So we are not adapted to their viruses. Now, if these wild animals viruses jump into us, we can get into big trouble, like this COVID-19 or the 2003 SARS. So I think that is a big lesson for us, that we have a new normal. We must conserve all the wild animals and their ecology and their habitats so that humans can live peacefully, harmoniously with these wild animals for the next generations to come.
Yeah, Professor Yuan, quick question to you too.
Yes.
We have seen the politicization of the origin of the virus. Now, one thing probably we can compare 2003 to now is the geopolitics have been tremendously different. So how do you see originally, which should be a science question, now become one of the biggest political questions?
I think that once you politicize science, this is bad for everyone because you are actually hampering the efforts of pandemic control. It's wrong. I can only say this, that it is a completely wrong thing to treat, to prevent another pandemic. If you look from a scientific point of view, this coronavirus may not necessarily come from China at all. Remember, these bats can fly long distance. They can be coming from Africa, from other parts of Southeast Asia, and then go into China. So if you ask where is the virus, it can be very far away from China. And to find them is almost impossible. So I think politicizing all these things are completely counterproductive to our pandemic control efforts. And I don't recommend it at all. We should not just continue to stimulate each other and continue the debate on something which is futile, which is useless. Rather, we can just focus on things that you have asked me. What is the new normal? How should we continue to live with the wild animals, how to continue with preventive efforts at airports, customs, and our daily life, how to prevent another disaster from coming. These are much more important than discussing geopolitics. It doesn't have anybody at all.
Professor Yuen Kwok-yung from the University of Hong Kong, a very well-known microbiologist. You're watching World Insight. Coming up in our program, Trump moves to suspend Chinese passenger airlines from the U.S. We speak to Professor Graham Allison to find out if the two largest economies can de-escalate tensions.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there to see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
The world is changing fast, taking all our lives with it. But we can change it too, by seeking answers to problems through discussions and debates. On World Insight, I ask direct questions to real people in the know, seek genuine answers, but respect diverse perspectives. Our live global debates tackle the most critical issues head-on. World Insight with Tian Wei go beyond the headlines.
Images may appear to be identical, but looks can be deceiving. The difference is not always obvious. It has to be discovered. There are always different sides to a story. We put the focus on the details. To see more, to understand better. CGTN. See the difference.
Welcome back. This is World Insight. I'm Tian Wei. Tensions between China and the United States are rising again. Lately, Washington said it would suspend all Chinese passenger airlines from flying into and out of the United States. With the U.S. politicizing the origin of the virus against China on top of serious trade disputes, cooperation between the two countries is getting ever harder. And how will the upcoming U.S. election affect ties between the world's two largest economies? I sat down with Professor Graham Allison from Harvard's Kennedy School of Government. He wrote a book unpacking whether China and the U.S. can avoid a direct confrontation against each other. Here comes his new observations. Professor, as we know, domestic politics these days, probably throughout history, has been closely related to the choices of international relations policy governments would choose. So, could you help us to understand, Professor, how are some of the things going on inside your country now, whether it is a racial issue or COVID-19 or the economic challenges and election season, how are they feeding into the policy choices today Washington take in the international policies?
During a political campaign, essentially everything goes. And I would say the most vicious war going on the globe today is the war between President Trump and Joe Biden, between President Trump, who believes he's fighting for his own survival and his vision of America that's greater again against a opponent, Joe Biden and Democrats, who believe that Donald Trump is the biggest threat to American democracy. So this battle is going to get more and more vicious, and unfortunately, I mean, now that we're talking about this in the context of China, China, which normally wouldn't be a major factor, will be a major target in this campaign. It's already clear that the Trump administration has concluded that a good line for its campaign is to blame China for coronavirus and the failure to prevent the spread of coronavirus, and therefore, and I would call this demonize China. Now, I would say both of these narratives are very far from the facts or the analysis, but in political campaigns, facts and analysis are not the coin of the realm. The coin of the realm is claims that have a certain credibility with the core constituency that the candidate is going to appeal to. So it's a pretty ugly process, and it will be an ugly process, and it will get uglier as we go forward. And I think it'll do damage to the relationship between the U.S. and China, because Chinese looking at this think, well, wait a minute, that's not us, and those accusations are not correct, and these folks are exaggerating. And I would say that's sort of the language of politics, unfortunately. And this time, I think it's going to be more vicious than ever, because really what's at stake here for the Trump team and the Biden team is not about China, but it's about each other and about the competing views and visions of America.
Shall I say, dramatically fast going down of the relations between China and the United States just over the past few weeks. And we still have 5 months to go before the ballot box opens. So many wonder what worse to come.
I would say they're getting worse now faster and more furiously than I had anticipated. I think partly this is, in fact, I would say this is more about what's happening inside America and inside American politics than it is about China or whatever has happened in the relationship between the U.S. and China. So, and I know that for people in the broader world looking at the U.S., they wonder what's going on. But I just repeat what I said before. This is a life and death struggle as Trump and his Republican supporters on the one hand, and Biden and his Democratic supporters see it. And it's a life and death struggle, not just for themselves, though it is for, in Trump's case, he worries if he were defeated, will he go to jail? What will happen to his family? Or what will happen to his network of people? But also, what will happen to his vision of America? And on the other hand, if you look at the people who've been rioting in the streets, or if you look at the campaign ads that are crafted by the Biden campaign, or if you look at the views of Vice President Biden, he sees Trump and Trumpism and the Trump agenda as a threat to America and American democracy. So this is a struggle, first of all, within the U.S., and China just happens to be a target in it. I think that therefore we'll expect that things will be, more and more nasty things will be said about China. I know other foreign leaders from time to time who watch this process have just said, well, I'll hold my breath and hold my nose until it's all over, because after that, they'll get back to business as usual. And most often we do. But I think this time it's going to be uglier than normal.
First round trade negotiation already have its achievements. That's after strenuous work from both sides, particularly for the negotiating teams. Now, are we going to see that first round achievement continue to be implemented? I've been talking to the Chinese side. It seems that there are very specific plans and barometers of implementation, and that has been reported periodically to the international community. But many also wonder whether there will be reciprocal, if we like that word, actions coming from the U.S. side. And as a result of that, creating a bridge between the two countries.
That agreement is now in jeopardy, I would say. Not yet collapsed, but under strain. It first came under strain because of the coronavirus crisis and the impact of that on the Chinese economy and now on the American economy. As the demonization of China in the American political campaign increases, Trump and his advisors are being torn between what, on the one hand, are economic advantages, both for the US and China, from the agreement and from maintaining the agreement. That's on the one hand. And on the other hand, well, this seems like we're being friendly with the Chinese, or this seems like we're being nice. So if we're being hostile, we should finally decide they failed to fulfill their agreement. And so I could see the agreement collapsing. At this stage, I don't know. I'm on the one hand, on the other. The tariff piece is only one of 20 pieces of the conflict that's going on. The tech piece is even, I think, more severe right now, as you watch the ban against export of semiconductors and the equipment and for producing semiconductors, which will have a big impact if it's implemented on Huawei and other Chinese advanced tech companies. So the tech piece of this has gotten tougher. And however bad relations are between the U.S. and China, nobody in the U.S. and nobody in China thinks war between the two countries is a solution. Thank goodness, because it would not be a solution.
Professor Graham Allison from Harvard University. The second part of the interview with him will be broadcast later next week. And that's all we have for today. If you'd like to see more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook account. I'm Tian Wei. On behalf of the team, thanks for watching and